Well, thank you very much for having me here today, and I was very eager when the Taoiseach and Michael asked me to come here today as well, because I have to say a very big thank you to everybody involved in this wonderful service, because you're not just doing an amazing voluntary job and you're not just doing an amazing community service, you're really helping the health service, because by the supports that you're providing here, you're helping people stay fit and well and healthy into old age, which is really important. And I know through this brilliant pamphlet that our nurses are now giving out in our hospital as well, you're providing people with support when they come out of the hospital, so they can maybe come out of the hospital a little bit earlier, or maybe when they get home have that little bit of extra support. So I am hugely indebted to you, as is the HSE and the Department of Health, for all that you do. This is a very special service, and I suppose sometimes when we have a service in our community, we can presume that this is something that's available all over the country, and let me assure you, as someone who travels right around the country, it isn't. What you're doing here is really quite unique. So I want to thank all of you, volunteers, staff, board, PJ, Deirdre, everybody, for all the super work that you've done. I've had a very exciting day in Mayo, though I think Michael did make a very good audition speech to be Minister for Health. We'll have to reconsider that, Taoiseach. But we've had a very busy day today. I started off the day visiting some patients with Alzheimer's, and was happy to be able to provide some additional funding there to keep a service on the road, which is really important. €700,000, 400,000 extra this year and 300,000 extra for next year. We then went and I had a conversation with some people in GMIT about how they want to train more nurses to make sure that we continue to make sure that the Northwest has adequate numbers of nurses for our hospital, which was good. We then went and visited Mayo University Hospital. We had a great meeting with management, good conversations with staff and patients, and there's a lot of good work going on there. The hospital has just been upgraded from a fire safety point of view. They're doing some work on infection control. HIQA did an inspection there recently. There's a new endoscopy decontamination unit about to open in December, and they've just commissioned 6 more beds for the medical wards. There's a lot of really good work going on there, but I suppose there is a problem, being very honest. The emergency department was built for about 25,000 people a year, and as you'll all know, there's an awful lot more than that attending. So we 38,000 people went to the emergency department last year, and we expect it to be even higher, probably near 40,000 this year. So we had a good look around. The hospital are going to do a bit of work to see if there's something we can do temporarily to put on a modular build to provide a bit more space. So the hospital are going to do a bit of work, we're going to do a bit of work, and over the next number of weeks we're going to see if there's something we can do to provide a bit of extra space at the hospital there in Castlebar, while we plan for a proper extension to give a new big ED, which I think will see the hospital right into the future. So that's what we're going to do there. We went up to the Sacred Heart Hospital there to look at how nearly €14 million worth of money is being spent on providing 74 new bedrooms, which are going to be great. Again, making sure older people are provided with dignity. There's an amazing service up there, and you just get a really good feeling when you walk in there, from the staff, from the residents, from people using the daycare facility. But they need more space, and they need to make sure that the rooms are, fit for a modern purpose, that people have a bit of dignity and a bit of privacy as well. So they tell me the roof will be on the extension by Christmas. The work will be finished by next October, and they'll start moving residents in there in early 2018. So there's been a lot of positivity and a lot of good stuff happening as we've gone around and visited the health services in Mayo. In general,